Yeah, greetings everyone. I am here to treat a very important topic. It is a serious one. I feel so much pity for those patients that are being placed on drugs, metformin. You see, diabetes patient being placed on glucamine or glucomine, whatever they call it. These are all synthetic drugs. Why am I doing this video? I met a patient yesterday. Someone called me and asked me to come check on her. On getting there, I found out that she has been placed on drugs for the past 12 years and nothing is working. No changes at all. How can a patient be placed on drugs for 12 years if it is something that will work? In the first months, you should be getting results. In as much as it isn't working for 1 month, 2 months, 3 months, there is no point continuing with such drugs. That is why I'm doing this video today, to enlighten you more what conventional medicines does to the human body. Sorry to say this, conventional medicines doesn't work well with our bodies. Our pharmacists, our medical doctors, the conventional ones, sorry to say this, they are not helping matters at all. How can you be placed on a drug for so many years, nothing is working, and you keep prescribing such drugs to your patient? You place that patient on such drugs? Don't you have conscience? It baffles me. And you, the patient, will believe and then subject yourself to such medical treatment. Oh, it's so pathetic. Now, let me tell you what continuous intake of such drugs. We've been brainwashed a lot. I'll do my little best in informing you the dangers of taking these drugs. Do you know that when you are being placed on whether glucagon diabetic drugs or metformin for hypertension, that this synthetic drugs goes into your bloodstreams, affects your liver. It spreads to your liver. They are toxins that are being deposited in your liver. So instead of doing you good, it is going to cause a lot of harm, because if you take them, as it enters your blood, it makes your blood to thicken. And every disease centers on not allow, as in when your blood doesn't flow very well. That's when your blood does not flow. Anything that obstructs the free flow of blood causes a lot of harm to you, even death. So once you take all these synthetic drugs you are being placed on, first of all, it thickens the blood, especially the insulin one. It goes there and thickens the blood, thereby not allowing it from flowing through your arteries. And once it gets to your blood again, what happens to your medium-sized, what's it called, veins and arteries? They are what we call ventricles. You see, diabetes means total blindness. Blindness. Once you are diabetic, you have lost your vision completely. So continuous taking of these insulin drugs will further aggravate your issues, because it will not allow blood to flow through your ventricles that connects to your eyes, those tiny veins that carries blood or nutrient-rich supplies of blood into your bloodstream. It first of all blocks it. It even melts it. You know, diabetic patients, they suffer sugar deposits in the blood a lot. Too much sugar. in the blood. And so, and which is caused by carbohydrate foods, which I've been talking about here. So those carbohydrate foods, they are acidic to the body. So what it does is you don't need all those conventional synthetic drugs to alleviate diabetes or insulin. They are natural drugs that you will take. Now, when it gets to your blood, it takes it and prevents it from flowing very well. Before you know it, it begins to melt. Those ventricles, tiny, very tiny, like threads, they are there. They are interconnected. They connect to your veins, to your eyes, to other organs of your body. And now, if there is an obstruction of blood flow, tell me what will happen. Your organs would gradually begin to destroy. Before you know it, you start having waist pain. Before you know it, you start having headache. You are on that drug, you are still taking that drug. Before you know it, your legs begins to swell. Your hands, you start having, what's it called? Shaking syndrome. Your hands are beginning to shake. It affects your brain, constant headache. You sit down, you start palpitating. Your heart start to beat faster. It is as a result of these drugs. Your organs are beginning to die slowly. You are on these drugs for 10 years. You are still on, oh my God. I'm so pained right now. I can't believe it. When I heard that lady told me she has been, and do you know another bad thing they do? When they start having these bad symptoms, do you know where they run to? Instead of them to use their head to know that, oh, think with your head to know that this drug could be, let me stop it. No, they will not stop it. They will run to meet the same doctor who prescribed those medicines to them in the first place. And when you get there on the, what's it called? A diabetic patient, like a diabetic patient, when you run to your doctor, the doctor will say, it's the insulin. You blame it on the insulin, your condition, not knowing that. Instead of telling you the truth that the drugs you are taking is what is actually aggravating your condition. He won't tell you because he's cashing out. He will prescribe another one and say, go and start taking. Okay, maybe you should stop the other. That's me. You know, they have them in a lot of different companies that they patronize. They will stop that one and they tell you, go and continue from here. This one, change that one and take this one. They will prescribe, okay. They will even increase the dosage this time around. See how you are killing yourself gradually. They will prescribe it in higher dosages and they give to you. You take up and continue to take again. You take gradually, you are dying and phasing out. Your sores no longer heal again because you have obstructed. When you're, like I said, once you are being placed on insulin, it expands your blood group, your blood, sorry to say, and then it can no longer flow through your arteries. When it is too thick, it can no longer flow through your arteries. You keep taking it, you keep worsening it. So you run to your doctor and they prescribe, increase the dose for you, keep taking. So what will happen to you? Medicine that will work will not take you more than 1 month. You start noticing the difference, just in the changes. You start having this feeling of wellness in you, you know? So we should wake up. Let's wake up. It's not time to start giving your life to conventional kind of methods of treatment. It is not wise. Stop it. Good thing. The body can respond. Immediately you stop all of this, the body responds and then rejuvenates. But whereby you keep taking it, you are digging your grave with your own hands. I have said my own. What is remaining now for you is to stick to what I've said and then leave conventional medicines alone. My next episode, I'm going to tell you what to take to cure diabetes and even high blood pressure. Even a simple change in diet and lifestyles can adjust your blood pressure for you. Okay, until then, see you under the stresses topic. Please subscribe to my channel. Okay, so that you can get more overdose of informations, health informations that will help you. Thank you very much for watching. Bye.